Hey everyone, Cameron Eldred here. I am a doctorate in athletic training student through Indiana State University, and today is just going to be a short video for my evidence-based holistic care 2 class in my program. And today we're going to be talking about my personal reflection on spinal evaluation, spine evaluation, and back issue evaluation. Overall, how I would rate myself in this, I actually kind of want to break this up into two different parts. So in my undergraduate education program as an athletic training student, we had a lot of professors who really, and preceptors who really hounded into us um, the evaluation of the C-spine. Um, it was one that was really just, we were always hitting C-spine, 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 C-spine. And what could happen, all the injuries, all the tests, how do you do cervical compression tests? What does a Valsalva maneuver do for you? How to palpate around the C-spine, things like that. And I got really good, and I'm really confident in my ability to evaluate a C-spine, especially in an acute situation. Prime example, a few weeks ago, I had a soccer keeper. She collided with a defender. Head first, she went down. And, I didn't even think twice. I immediately went out, started my evaluation. And I was extremely comfortable. I knew exactly what I was doing. I was very surprised with myself at how quickly everything came back to me. I've never had to do that before. I've never had to evaluate a C-spine. I've never had to think about, am I going to spine board this person? Now, granted, those of you who are watching this, you may not know. I am recently certified. I just graduated from my undergraduate program a few months ago. So this is my first real opportunity to practice as an athletic trainer on my own. And so I've never had some of these opportunities before. I've only one other time had the opportunity to participate in the spine boarding of a patient. As tragic as it is when it happens, it was a great learning opportunity for me, and I was able to observe somebody else in their C-spine and back evaluation of an on-field patient, a patient who was on the field. So I'm very, very confident in cervical spine and upper thoracic evaluation. Very, very confident. However, once we get down into lower thoracic and lumbar, it gets a little bit more dodgy for me, and I shouldn't say that in a negative connotation. What I mean is I'm just not as comfortable with it. A lot of that stems from it's not something that was focused on a whole lot like the cervical spine was in my undergraduate degree. And so, I can look at a patient, I can identify, are they, lordotic? Do they have a kyphotic curve? Do they have scoliosis? Things like that. I can perform the special tests. I can be like, okay, we're going to have you do a standing stork test so we can, test for spondy. We're going to do a bowstring test so that we can look at, compression of the sciatic nerve. I can perform a Hoover's test, things like that. I can do all of these things. They're just not something I'm as comfortable with. I can't perform a test such as a slump test and, specifically say, yes, I think this person has a disc herniation. I'm just not as comfortable with that. And I think a lot of that just stems from the fact that I'm unpracticed when it comes to the lower thoracic and lumbar spine. I can palpate, I can identify bony landmarks, I can go through the muscles, the musculature, I can really identify those types of things. But once it comes down to those chronic issues, I kind of start to wonder, am I going in the right direction with this? And I think part of that is a confidence issue. Am I confident enough to go in and say for sure, yes, this is what I think it is, and thus I need to get you into a doctor and have them confirm just what I had thought it was. But when I am evaluating the spine, something that I do find useful and helpful is, just pulling out my old books, pulling out some of my old notes. If I'm not 100% sure on, a patient. So if a patient comes into my office and they say, hey, I've had this lingering back pain for the last couple of months. This is what it does. I'll do my evaluation. I'll do all my tests. At that point, I will kind of think through what exactly could be going on with them, and I'll kind of put them into a therapeutic intervention at that time that I feel like would be appropriate. And then after, the patient leaves and I have a little bit of time to myself, I make sure I walk through my notes that I took of that patient, and then I go through my books. I go through the Principles of Athletic Training book. I go through the Examination of Musculoskeletal Injuries book that I have. I go through all of the special tests, and I think to myself, okay, this person was positive with this, this, and this. They were negative with X, Y, and Z. So I think that it could be this. And at that point, I make the decision, okay, do I need to send this person into a physician? Or can I treat this as a strain or something similar that can be treated just here in my office? So that is something that really helps me in guiding my clinical decision making. It's just a reflection on my notes, and since it is something that I'm uncomfortable with, I'm not embarrassed to say that I do refer back to my books, because I did just graduate, and that's not a big deal. It's, athletic training is a consistent learning career. We're always learning something new. We're always improving on our skills, and this is something that I'm just not as comfortable with. So being able to review my learning materials truly provides me an opportunity to guide myself and improve. So really overall, what I'd like to improve upon the most, I think, is the evaluation of the lower thoracic and lumbar spine. Mostly just because it's something that I'm uncomfortable with. I can do it, and I can make my assumptions, I can make my guesses, I can go back to my books, but what I would like to be able to improve upon is not having to rely as heavily upon the literature. I would like to really be able to look at myself and be like, yes, I am, confident, very confident that I know exactly what is going on with this patient. And I want to be able to do that as quickly as possible, but I also understand that this is a learning process. This is something that I'm not as comfortable with. And so it's going to take time, especially once you start involving, hip rotation and all sorts of other things into it. It can get very complicated. The lower back, non-specific low back pain will be the bane of my existence at this time. But again, that's why I want to improve upon it, so that it will no longer be the bane of my existence, because I will understand it. I will have a thorough understanding of how to treat it and how to improve my patient's quality of life. So overall, I just wanted to say that there are a lot of things that I'm very comfortable with when it comes to the cervical spine and upper thoracic. I'm very confident in everything that I do with that, especially when it comes to acute on-field examination. Where things start to get a little bit more muddy for me is, again, just that lower back. It's not easy, especially once you start throwing other things in there, such as hips. So again, I'm always striving forward. This is something that I was previously working on before, and it just so happened that this assignment of reflection played into that. And so thank you for listening. Thank you for allowing me to get my thoughts out and create this personal journal for myself. And it's been fun, and we'll see you later. Thanks.